Hi, I'm Christian and welcome to my channel. I'm an osteopathic manual practitioner and my clinic, Eurosteo, is based in Ottawa, Ontario. I make wellness videos where I show advice I give to my patients, and don't forget to click the subscribe button to ring the bell for notifications, and don't hesitate to leave a comment and suggestions for future videos, and thank you for the like. And here we are to show a few advices about the neck, exercises also. I didn't include it in the previous video about posture because the neck is very specific. But we come back to a few common exercises like the self-growing. So you push your head towards the ceilings to contract all the small muscles from the occiput to the sacrum, like we can see here. Then you will push your hands together to contract the pectoral muscles very strongly for 6 seconds, and then immediately after squeeze your shoulder blades for another 6 seconds, and then rest for 6 seconds. That is an active stretch to open the shoulders, contraction of a muscle, what is then neutralized, contraction to the opposite muscle, it gives a stretch. Specifically for the neck, it's very difficult to include it in a global demonstration because the neck is specific to everybody. We have always to adapt. Never forget this. When you do any kind of exercise on the neck, if you feel any pain, feel any tension, stop, don't go further, do it differently, adapt, adapt, adapt. The next, there's still some little exercises you can do to relieve the pressure on the disc, to relieve the muscle tension, to mobilize, to give more vascularization. And that consists to do different kind of extensions. There's actually 3 types of extension we can do. I will show them in a few seconds. But to know that if we want to move our neck, do analytic movements, so not a combination of different movements like we can see sometimes on some sport fields. So flexion, extension, pour, side bending, or rotation. If you do an association of different movement, like here's a figure 8 kind of, when you are in this position, left side bending and rotation, you will pinch possibly a nerve on the left side and pull the artery, the vertebral artery on the right side. And we don't have x-rays here, we are not in a session, so we cannot test always when we do it ourselves if the artery can be a bit calcified, if you have osteoarthritis, what starts at the age of 20 for everybody in a different grade. Often in the morning, we will feel some tension in the neck, like sand, a sand feeling between the vertebrae. So that is where we can do 3 different kinds of extension. All of them, 1, 2 of them, it's up to you. Good to do early in the morning when we feel stiff. So the first one is a pour translation, like if the head would be on a plank. So you push your head backwards like this 10 times, why not? That helps to relieve some tension between the occiput and the first vertebrae, and help also to give some dynamic, if you want, in the disc, without to pinch them, without to do something very powerful. The first type of extension is more for the upper part of the neck, and that will be to lift the chin towards the ceilings, like here, like if the ball of the head would roll on the first cervical vertebrae. Then a more global extension for the mid and the lower part of the cervical spine is to look at the ceiling. So the head goes backwards. You see a bigger range of motion here. So same thing, do that 10 times, each of them. That will give some relief there in the joints, and often we feel a real better mobility. Some people need to have some passive help, and that would be a taping, for example. I like to use K-tape, like here, Elastoplast, whatever is the brand, but a good type of tape. Remember, it is passive. So the idea, and I will not use them here directly on the skin because they are too long, is to put on each side of the spine one band, and to help the head to stay in a neutral position. So this one we will cut in half, attach it on the upper part of the spine and pull down, really to have a tension to the neck. Of course, the head in a neutral position when we put it on. That will help not to have to focus too much on our neck when we work in a weird position. It exists. Some jobs, they have no choice, and for a few hours they need to stay in that type of weird position. So this can help to relieve the tension in the muscles, but it's passive. So don't wear it out of the time you need to do it. I like to add some active exercises, kind of strengthening. We spoke about it already, about the upper back, the sitting posture. So you can here work on the rhomboids, the muscle around the shoulder blades. If you put your arms lower, it works on the upper part of the cervical spine. There are many different positions. You can work from one side, from both sides. On YouTube or anywhere else, you will find a lot of videos about it. Coaches, physiotherapists can show you all what you can do with elastics. And you see here, can attach it on a stool, can attach it on a wall and pull behind. A lot of possibilities to have fun, to do this kind of exercises. And that's actually the idea. Do what you feel the most convenient and helpful for yourself. What you can do without to need a big adaptation, carpet or whatever. Have fun.